My wife recently underwent radiation therapy at the VCU's Massey Comprehensive Cancer Center here in Richmond, Virginia. And fortunately, that's where I work. So as a board-certified medical physicist. And because of this, I am privileged to know that the treatment that she has received isn't just about the quality of radiation medicine, but it's also about the machines, the calibrations, and the fine-tuning. Let me show you what I mean by this. Imagine you're buying a new car. Before you drive it off the lot, you probably want to test the brakes, right? You want to learn how it handles. You want to keep it tuned, right? So the same is true for these treatment machines that deliver radiation therapy to cancer patients. And these are called medical linear accelerators, or LINACs for short. That's what we call them. So these LINACs deliver invisible beams of radiation to these tumors with extraordinary precision. But here's the catch, okay? Every single LINAC, even if it's the same model, behaves a little differently. So before you can use it for patient treatment, you have to commission it thoroughly, okay? Using all kinds of equipments to calibrate the output of the radiation, verify the accuracy of these systems, and ensure patient safety. And so how do we do that? How do we exactly do that? We use something called water tanks. These water tanks, when filled with water, mimics radiological properties of human tissue. So therefore, if you fill it with water, it's a lot of water, so it's about 500 pounds when it's completely filled. And you put this water tank carefully underneath the LINAC, and you measure the radiation dose. You measure all kinds of invisible radiation beam and characterize with it. So it's pretty cool, right? Okay. Except that these tanks are rigid. They're heavy. They cost upwards of $250,000 with the fancy features. And if you try to commission a LINAC with this water tank, that could take up to several weeks. Weeks when the machine has to be offline, idle, and patients wait. Okay. So now let's talk about what happens if you need to move one of these tanks. Why would you do that? Well, if you are a big healthcare enterprise, you might have multiple clinics throughout the city that you're operating in, like VCU Health, right? So, but you can't just pick up a tank and go, right? You need movers, you need special equipment, and it can cost like $2,000 per move within city limits, and the price of that would just skyrocket beyond that. These tanks have gotten bigger over the years. They've gotten more sophisticated, but they haven't really gotten more portable. And that's a major problem, okay? And I don't know why they're not portable. And that's a major problem because you can't, if you're trying to reach these patients in underserved communities, nationally, internationally, so that's a problem. So these LINACs needs to be comprehensively checked, at least annually, okay? And if you're a clinic with multiple operations, that means that you either have to buy multiples of these $250,000 tanks at every location, or that you have to pay thousands of dollars to move them from location to location of your operation. So neither of these options are ideal, right? But this is the reality. This is the reality of everywhere in the world. It's like this. And so I had a question. Why couldn't I build a portable water tank? Okay. And at the same time, why couldn't I build it such that you can speed up the measurements, so shorten the process, and also improve the quality of the treatments, right? A man can dream, right? And so that's what I did for years until I got lucky a few years ago when I met a brilliant theoretical physicist named Marcos Feiju. It's the guy with no hair. And I'm sorry. And Marcos has started this company called Blue Physics, where he was developing these plastic scintillators. So these are detectors that literally glows with the visible light when hit by a high energy radiation. They're really cool. So, but when I saw them, his product, I could see that it was very fast. It was very accurate. But most importantly, it was very small. So I realized immediately there and that this would fit perfectly in a portable water tank that I was dreaming about all these years. So we partnered up, okay? And I lead the design of the water tank and the testing of it with the beautiful VCU team. And he provides the embedded detector technology along with developing the entire software with the system. And so together we filed a joint patent, and we were fortunate to secure grant funding to kickstart this project. Okay. Our goal is to cut the commissioning time from weeks down to days. Cut the price from $250,000 down to less than $50,000. One-fifth the cost of it. And build it so portable that you can ship it anywhere, between any two clinics, however far apart they are, even between nations. Think about the implications of this, right, on the practice of radiation therapy. So this Linacs cannot sit idle for weeks. Patients can't wait. Clinics cannot afford it. So I think this portable water tank could really solve that problem. But what really excites me are that these tanks isn't rewriting the entire concept of water tanks. And that's important because you want these clinics to adopt it and use it immediately because they're used to the water tanks, right? And so it's not a radical departure of a new idea. It's a practical, logical evolution of this technology. Okay? But our mission isn't to just build this water tank and stop there. Our vision is not just to offer the tools, but to offer the entire solutions around the commissioning of it. Because we want to help these clinics worldwide to deliver better, higher quality treatments to these patients with the efficient and affordable manner. Okay. Because at the end of the day, what motivates me are the patients, the families, like mine. The people that are just waiting while these machines that needs to be tested. My wife's recent radiation therapy has brought that home to me, for me, in a way that nothing else could. Cancer care has made tremendous advancements in the last decades. We could deliver radiation with millimeter accuracy. We could adapt treatments as we deliver them in real time. I do that all the time, actually, at my work. Okay, so we can save lives. Right? That would have been just lost just a generation ago. We could do that. But none of that matters if the machines themselves are not working. If the commissioning takes so long, if the clinics around the world cannot afford these expensive equipment, right? Innovations in healthcare shouldn't always be about the next breakthrough drugs or the next greatest technology that is expensive and all that. But sometimes It should be about taking what is essential, what is core to the workflow, and making it better, okay? And simpler and more affordable to everybody. And that's what this water tank represents for me. It's not flashy. It won't make the headlines. But it could help ensure that when a patient needs radiation therapy for their cancer, the machine is ready. Calibrations are done. Treatment begins. Because every day counts. And no patient should have to wait for their treatments anywhere. Thank you.